Today, my chosen topic is on tobacco addiction. And the question I'm posing is returning to medicinal plants the world answer? We do actually have a tradition of using herbs to treat tobacco addiction. For well over 100 years, maybe even 200 years, herbalists have advocated the use of Lobelia inflata, containing the alkaloid lobeline, for smoking cessation. And this seems to work because lobeline has similar activity in the body to nicotine, so it's kind of like replacement therapy. Well, a few decades ago, the FDA banned the advertising of Lobelia for smoking cessation because they said there was no evidence. But the interesting thing is there's another medicinal plant for which there is actually very high quality evidence, and that is the common or Scotch broom. It contains an alkaloid called cytisine. Its botanical name is Cytisus scoparius. It was known as Sarathanus scoparius, and that's how I learnt about it as a herbal student. And cytisine has been found to be a safe, cheap, and effective treatment for helping smokers quit. In fact, it's been licensed in Eastern Europe as an aid to smoking cessation for over 40 years, but until recently, quite ignored in the West. Now, it's interesting to ask, well, why has there been all this amount of drug research when there's a simple answer in a herbal extract, or at least an alkaloid extracted from a herb? Why has that happened? And the answer, of course, is for the big pharmaceutical companies is the profit motive. It's far better that they that they manufacture a new drug, then can put a patent on it and control it and charge thousands and thousands of dollars for treatment. But there's another aspect, I think, why cytisine has been ignored in the West, which is more fundamental, and that is in most of the Western world, and especially the English-speaking world, there's this inherent prejudice against herbal medicine. And the common mantra I hear chanted all the time is there's no evidence. Well, there's in fact abundant evidence, and witness my postings here on my Facebook page. And I could go on for years and years just posting up all the current evidence that exists, not so much, notwithstanding even the new evidence that might be generated over those years. So there is abundant evidence, but among journalists, scientists, many medical doctors, we see this prejudice that there's no research, there's no evidence base for herbs. And so they immediately see a product from the Eastern Europe that is used for smoking cessation and think, oh, it's just a load of typical herbal quackery. Well, emphasize again, safe, cheap, and effective. Let's look at in more detail at the research on cytisine and indeed the issues with the common drug that's being used. But before that, just a little bit of a chemistry. This is comparing structures. So firstly, we have nicotine with lobeline, and you can certainly see there's some similarity between this, at least half the structure of lobeline versus nicotine that would act on nicotinic receptors. But with cytisine, it's quite different. I mean, they're all alkaloids. You see, they've all got nitrogen in the ring, meaning they're all alkaloids. But cytisine is actually quite different. And you can't, at a glance, just looking at the chemical structure, suggest that it would interact with the nicotinic receptor to reduce craving, but it does appear to do so. So the main drug that's been used to help people give up smoking is a drug called varenicline. And it has problems with potentially, although rare, potentially very, very serious side effects. So the standard side effects that a lot of people get include nausea and abnormal dreams. But there's growing evidence of a link to aggression, depression, and suicidal tendencies, which caused the FDA in 2008 to issue a public health advisory warning users and doctors about the problem with this drug. So this suggests another look at cytosine, and I'm wondering if that's not the reason why Western researchers are now beginning to consider it as a really interesting and viable option. And we need look no further than here in Australia for that research interest. This is a press release from the University of New South Wales, and look what it says. Low-cost natural quit smoking aid is effective and needs wider global access. And this is a high-level study. They published it in the Journal of the American Medical Association. And what they were trying to do is compare the efficacy of varenicline with cytosine in a human clinical trial. It was actually in a particular cohort of people with HIV with substance use issues, but nonetheless, it would reflect on a general population as well. And they set a high bar for the cytosine. So it had to work 5% better than the varenicline to be considered an equivalent treatment. That's a high bar. And by 5%, I don't mean, 5% of 20 was one extra person. I mean, if the varenicline worked in 20% of people and helped them give up, then the cytosine had to work in 25%. That's how high the bar was. Well, the cytosine was 2% higher, not the 5% that they required, but that's still pretty good. So what did they find? Well, because of this 5% level that they set, they couldn't include that cytosine was as good as varenicline. Non-inferiority is the technical term they use. But they did establish other important findings. The first is that for varenicline, the treatment is over 3 months, where cytosine is 25 days. That's a huge advantage. And again, that's another barrier to the use of this drug, because a lot of people will stop. They're not going to take it for 3 months. And that was observed by one of the researchers from the University of New South Wales, Dr. Courtney, who said that people who smoked often stop use of smoking cessation age because of the times involved, but also, of course, the time involved where you're getting the side effects like nausea. And what did they find? There were fewer adverse effects for the cytosine. They occurred less frequently compared to the varenicline, and nausea and abnormal dreams were significantly less. And he said this is an encouraging result that may lead to more smokers taking up this treatment option. As we know, adverse effects, as I mentioned, often lead to treatment discontinuation, he said. So here was another one, clinical study, mainstream clinical study. As I said, the interest in the West is now growing, that looked at people with a recent diagnosis of lung cancer. And obviously you want those people to give up smoking. So they did a 12-month follow-up and achieved a quit rate of 32.1% versus the control quit rate that was only 7.3%. That's quite a good finding. There were obviously, because it's an alkaloid and it's reasonably powerful, some adverse events recorded for the cytosine versus the controls, 399 events versus 196, but none of them were deemed to be serious. And what the results authors said is that the efficacy and safety that they observed for cytosine, a very low-cost medication, makes it a suitable treatment option for smoking cessation, and particularly in the case here where they want to have it benefit patients with a diagnosis of lung cancer and allow them to do better screening because they've stopped smoking, using computing tomography, et cetera. So let's have a look at the practicalities of it. This is what you do. So you see in this box here the cytosine dosing regimen. But first let's look at the left. Cytosine mimics the action of nicotine. It's not a new drug. It's been safely used in Eastern Europe for smoking cessation for 50 years, and it's effective. And let's go to the dosage regime. 1 capsule every 2 hours, up to 6 a day for the first few days, and then you gradually decrease over the full 25-day period till you're taking 1 to 2 a day for days 21 to 25. And the author of this discussion, or this advice, pointed out that a majority of smokers now live in low and middle income countries. They cannot afford modern pharmaceutical drugs. They can't afford to pay thousands and thousands of dollars for these drugs to help them give up smoking. You could even make, Scotch broom can grow so abundantly it can be a noxious weed in some places. So you could easily grow it. It doesn't need favorable growing conditions at all. It's a really hardy plant. Harvest the leaves, extract them with alcohol and water, measure the amount of cytosine that they contain. So you kind of got a standardized liquid extract. And so the dosage then becomes, like 0.5 ml instead of 1.5 milligrams. And you've got a drug to treat, an effective drug to treat tobacco addiction that costs virtually nothing, that everyone can afford. So my question is, why isn't the WHO jumping on this? Surely we need to get this drug approved. We need to even work with communities in various countries, so they develop a cheap, even herbal version of the cytosine and help people to give up smoking. Thank you. And I hope I've been able to demonstrate that there's a huge untapped potential for herbs and phytochemicals extracted from them.